Do you have a child or client with autism or signs of autism who is not yet speaking or speaking just very minimally? Today, we're talking about how language should and can progress, and we're talking about echoics. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today's episode, we're focusing on echoics and how kids go from completely non-vocal to speaking with Dr. Barbara Esch from podcast episode number 220. Let's get to it.
Things happen in a sequence, and speaking is a mechanical skill. It becomes a much more sophisticated automatic skill of moving all of your articulators, your tongue, your vocal cords, your lips, your jaw. All of that has to move in concert along with breathing and all of that sort of thing. But it happens in particular sequences. So if you look at a newborn infant up to about the age of let's say 3 to 5 months, most of what comes out of their mouth are vowel sounds, and they're still learning to move their tongue in various positions. They're learning to breathe and vocalize on exhalated air, not inhalated air, because infants do phonate or vocalize on inhalation. So that has to all kind of get in place. And then they begin to make some consonant sounds sort of randomly. And at that same time, parents and other caregivers are reinforcing the ones of those sounds that occur in whatever the language is of that family, that caregiving unit. And so those sounds, those syllables get selected, and so they're sort of automatically reinforcing, and those are the building blocks. So for example, sometimes I've heard people say or ask, well, if they can say mama, isn't it the same difficulty to say mommy? And it isn't. And the reason it isn't, even though you have the same consonant in both of those, the M consonant, you have 2 syllables in both of those, mama and mommy, that you don't have the same vowels. In the first one, mama, you have the same vowel repeated twice. Just repeated. It's called reduplicated. And that's what babies do. Ba, 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 mama, mama, mama. We hear that all the time. And then they begin to sort of expand and vary some of those other vowels and consonant sounds. So when we code, and this is what speech pathologists know how to do, we code what children say or what learners say. We can assign a code, how many different consonants were in that, how many different vowels were in that, and that's what we call syllable complexity. And in my new manual that's coming out, I think we'll talk about that in a bit, there's a whole chapter on syllable complexity. So that's what you learned at that workshop, was kind of my attempt to have people be comfortable with misarticulated fledgling syllable strings that beginning learners are coming out with. And it doesn't matter whether they're 2 or 12 or 22. Yep. It's important to think about, kind of to do a baseline of what are the skills that they have right now what kind of, how complex are the syllables that they can say, and what's the next higher complexity level? Let's take them to that next higher level. And if you approach it like that, if you approach speech training like that, it will never be easy, but it's much less difficult because you actually can kind of take it step by step, and you can go from, for example, tata to taka to taco, and now you've got a usable word, but you couldn't get there in a leap. You have to kind of go in steps.
Yeah. So this coding that you do, that you're talking about, I kind of think of it like as a little shorthand. And I was always impressed by speech pathologists who would be in the room with me, and they'd be scripting out, like I couldn't even hear it because I'm not trained in that. But I remember a couple other things from the 3-hour workshop. Again, we're going to be able to link that in the show notes. That's going to be marybarbera.com/220. That's going to be Barb's episode. But you did mention it, but vowels are the first babbles usually. So ba, ba, and the B or the M, they'll usually come a little bit later. But you also talked in that workshop about vowel neighbors, I think you called it, and that and versus A versus and there's like 5 different A's. Or whatever, like there were just so many. Is it the is it like apple? Is it like at a dentist going is it a, just so complex. So if you have a non-vocal child or clients, it really is important that you have a speech pathologist on the team if they're becoming, vocal, to help you figure out what is the baseline, if that's possible. I hope you enjoyed that small clip from podcast 220. If you did, you can listen to the whole podcast. Information is below. And if you enjoyed it also, I would love it if you give a thumbs up, leave a comment, or share it with somebody who might benefit. And for more information about how you might be able to join our online course and community where you can learn proven strategies to increase talking, decrease tantrums, improve eating, sleeping, potty training, and more, attend a free workshop today. And I'll see you right here next week.